Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The focus of this presentation is diabetes and what are the potential complications of diabetes. Diabetes is a lifelong disease. Diabetes is a progressive disease. Diabetes is associated with multi-system problems. Even though we think of diabetes as just a sugar problem, in reality, diabetes is a multi-system problem. It involves every system in the body, all the way from the brain to the heart to the lungs, kidneys, vascular system, neck circulation, and foot, eyes, you name it. Kidneys, it involves every system. So let us dive right into the feature presentation and try to learn something about diabetes complications. I hope you can see my green arrow here. Before we go any further, I would like you to refer you to the American Diabetes Association website, which is diabetes.org, where you get all the information you need to as far as public education is concerned. I'm going to be talking mostly about, from a medical perspective, what are the diabetic complications we come across and what are the things you need to be watching for if you have been newly diagnosed to have diabetes mellitus. 422 million people have diabetes. That's one out of every 5 to 6 people in the United States have diabetes. That's an astronomical number. And as you can see, 3.7 million people die due to diabetes and high glucose alone each year in the United States. 1.5 million deaths are caused by diabetes. So, diabetes, as I told you at the beginning, involves every system in the body, starting with the brain circulation, heart, peripheral vascular system, eyes. It involves foot, kidneys, and the nervous system. That is just the tip of the iceberg. It also involves eyes and skin and dental issues, which we will cover in this presentation. So let's look at cardiovascular problems. Diabetes, as I told you, is a systemic disease which not only affects your glucose ability to move your glucose into the body or utilize glucose, but it also has problem with insulin secretion or insulin utilization or what is known as insulin resistance. It also involves changes in the vascular blood vessels in the body all across the body from head to toe that leads to hardening of the small arteries and arterioles, leading to poor circulation, which causes many of the complications like heart attack. As we can see, patients with patients with diabetes have a higher incidence of coronary artery disease. They have 2 to 3 times the increased risk of heart disease. They have 30% increase in coronary stent implantation in 2011 alone. 280,000 heart attacks are reported among diabetics. They have higher incidence of morbidity and mortality with the heart disease, and 60% of these people are likely to die from diabetes related heart condition. So, does control of diabetes help to reduce the cardiovascular risk? That's a great question. And certainly, yes, controlling the blood sugar very accurately and getting on a diet program, lowering your cholesterol, which is also a problem related to diabetes, and getting on a regular exercise program will dramatically reduce your cardiovascular risk, especially if you have diabetes. If you add smoking, that can astronomically increase your risk of heart disease. So cutting smoking should be of top priority, especially if you have diabetes. Now let's look at the next item, stroke. Before I go into stroke, I want to talk to you about this vascular problem I was talking to you. In a normal healthy person, the artery lumen is clean and the lining is very smooth, and it is made up of one layer of endothelial cells. But in patients with diabetes, which involves the small arteries, the smallest arteries, and medium-sized arteries, there is buildup of this cholesterol, fat, plaque, and all the debris, which leads to blocking of these arteries, which leads to poor circulation that can cause all these multi-system problems we see in the heart, in the kidneys, in the brain, and in the legs. Let's talk about stroke. As I was telling you, because of the hardening of the arteries, these patients develop what is known as atherosclerosis or accelerated atherosclerosis. They can block off these tiny branches and lead to a stroke. The incidence of stroke is considerably higher among diabetics because they not only have hardening of the arteries, they also have high blood pressure, they have high cholesterol, and they have all the high blood sugar, all of this which act as risk factors for development of these blockages in the arteries. They are also prone for microaneurysms, that's like bulging of the arteries, which weaken and can bleed into the brain tissue, leading to a stroke. So control of blood sugar, diabetes, control of high blood pressure, and reducing cholesterol and diet and exercise should be an integral part of reducing the risk of stroke in patients with diabetes. And as you can see, the incidence of incidence of stroke goes up quite dramatically depending upon if you have no high blood pressure or diabetes, and if your risk is 1. If you have a high blood pressure, type 2, and diabetes, your risk is 4 times. That's 400% more than a person without history of diabetes and hypertension. Recognizing this and controlling your diabetes and high blood pressure should be of paramount importance if you want to reduce the risk of a stroke. And patients with diabetes who do get stroke, they have much increased morbidity and mortality. It takes longer time for them to recover. They have more residual stroke deficits, and their mortality is also slightly increased because of diabetes. Let's talk about kidney problems. There are 30 million people, that's almost 1 in 8 or 9 person in America have some kind of kidney disease. Patients with diabetes are much more prone to develop kidney disease for a variety of reasons. And let's look at what are those reasons. As I mentioned to you, these arterial changes in the glomeruli can reduce the blood perfusion to the kidney filtering apparatus, as you can see here. Also, because of the changes in the glomerulus, the filtering apparatus, and the arteries, there is leak of protein in the urine, leading to proteinuria, which is an advanced sign of a kidney problem in patients with diabetic nephropathy, as it is called. Because of these problems, there is reduced kidney function, leading to reduced urine output and fluid retention and proteinuria. Eventually, they may go on to develop kidney failure if we don't control the blood sugar, if we don't control the hypertension, and if we don't control the cholesterol levels, then we may end up needing dialysis. So it's very important to prevent kidney problems, especially if you have been newly diagnosed to have diabetes mellitus. Let's talk about retinopathy. Retinopathy are the changes that we see in diabetic patients inside the eye. And here is a cross section of the eyeball, and this is the lens, this is the cornea, and this is the globe behind the lens and the cornea. And here we have these blood vessels which are real smooth and normal, but in a diabetic patients, these arteries are kind of narrow because they have plaque buildup. There's also bleeding spots inside the eyes that can give like a cotton wool spots floating in your vision, and it can also lead to cataract, early cataract in diabetics. So if you have diabetes, your eyes need to be checked every year for development of any of these complications, and including glaucoma, so that they can be addressed at the earliest stages. And here's an example of all these hemorrhages, and as you can see, the aneurysms of these tiny arteries, along with bleeding and exodus and cataract development, and of course, pressure buildup in the eye leading to glaucoma. Dental problems. Because diabetics are prone for infection, these people are prone for more instances of dental infections, and there's also involvement of the gum, and healing takes longer time. And keeping your mouth clean with mouthwashes is of very great importance, especially to prevent any infections. This dental caries or decaying of the teeth are more common among diabetic patients. And here are some of the other things that we can see: tooth decay, taste impairment, delayed healing because of high sugar and diabetes, gum problems, and of course infections. Anytime you have infections anywhere, you should be of it should be of great concern to make sure that you get that infection under control. Otherwise, with diabetes, it may flare up and become more significant problem. Okay, now let's talk about neuropathy. Neuropathy simply means involvement of the peripheral nerves in the body, like in the arms and feet. So we see patients with diabetic have their nerves damaged because their circulation to the nerve terminals, fibers, are reduced, and a combination of reduced circulation and damage to the lining of the nerve fibers leads to loss of function. People feel numbness, tingling, and sometimes they can have sharp pain going down the feet. And diabetic neuropathy is characterized by this pain, numbness, tingling, and burning, irritation, which can be very, very disturbing, as a matter of fact. In addition to that, when we are talking about leg and foot, they are also prone for development of these changes in the nerve bundles itself, because of the blockage of the blood vessels supplying these nerve fibers. There is damage to the nerve fibers that conduct the impulse to keep the function of the nerves intact. And as you can see, here's a normal healthy tissue with nice arteries and circulations and veins. But in patients with diabetic, the circulation is poor. As a result, it can lead to gangrene. And patients with diabetes also have vascular disease known as the peripheral arterial disease, which is blockages of like medium-sized arteries in the legs that can lead to gangrene, ulcerations, gangrene. And because of these blockages in the arteries and nerve damages, they can also lead to like death of tissues, leading into dark blue color changes which may need amputation in order to prevent any serious sepsis forming and spreading to the rest of the body. And here, as you can see, the progressive changes that we see in diabetic foot problems, going all the way from stage 0 with no problems, leading to ulcerations, and the development of gangrene, and a whole foot is having no circulation, leading to like a dead tissue which has to be amputated. It's not uncommon to see people having toe amputation, half of the foot amputation, or below the knee amputation because of poor circulation. However, controlling blood sugar, controlling cholesterol levels, which is also an issue in diabetics, controlling hypertension may reduce the rate of progression of these vascular and neurological problems in diabetic patients. So here's an example of a non-healing ulcer, which has to be treated very aggressively, and with time, it takes a lot of time for it to eventually heal. And foot infections are very common in diabetics because of moisture and also because of the poor circulation. So ladies and gentlemen, almost 422 million people have diabetes, so you're not alone. There is tremendous amount of information available for resource and for education and for understanding. Please do visit this place, consult with your physicians, and take precautionary measures. That is, be proactive and prevent getting any complications from diabetes. That's the best way to deal with it. And visit the American Diabetes Association website and learn as much as you can. I hope this presentation has been educational and useful to you. We have numerous health related educational programs on this website. Please do subscribe to our YouTube channel, and I will see you in the next presentation. Thank you so much.